women and men with borderline personality disorder needed help, were in pain, and had real problems, because for a long time we didn't believe them. And I feel the second part of my career, I'm doing that a little bit for what we call high functioning, low need, autistic women in particular, and men have often been misdiagnosed. So we can, next slide, thank you. So, a little bit of updates, and everything is in Spanish, so that's better. Es una diferencia. Per me, no, it's very different than what you see with the children. I'm speaking with adults who have a work, who talk, or who some didn't talk until 12 or 13, but when I see them, they're different in terms of invalidità, the handicap, that's what you see here, I'm totally sure. But we'll see still a lot. It's not an illness that you have and we take away. I think, and borderline probably too, it's a neurodevelopmental problems. And sometimes if you learn a lot, you can function in the world and you will not be considered as with incapacity, with invalidità. And I'm not the only one thinking that way, but it's still a little controversial, and I do not want to minimize the terrible difficulties when you have autism early in life, with epilepsy, with intellectual disability. Of course, this is another way we have to work and help. I'm speaking from different, I'm coming from a different place. But we see that when you look at the neuropsychological testing, there are things in the brain that are similar. And that's where I think it's important. There are things in the sensoriality that are different. The autistic children don't fall in a black hole and never become adults, they become adults. Now, for many years, they were in institutions or they were abandoned, so nobody knew how people would evolve. I think because society is giving support, education, care, you will see people now with abilities that they would never have learned in the previous times. We think it's more and more, I don't know why, right? It's 136 in the US, I saw a number in Buenos Aires. I suspect it's probably the same everywhere, depends the criteria to diagnose. And if the past we say you can be autistic because you're women, then we remove a lot of the people there. So that's important. The fact that they don't speak, and that you know again, it doesn't mean they don't have a mind and cannot communicate. We have a wonderful example in the US of young activists who really help with that. They have empathy. That is one of the worst, and I imagine again, maybe you know this, but one of the worst myths about autistic people is that they didn't have empathy. And we've known study, we saw neuroimaging study. No, you have autistic with empathy and without empathy, like non-autistic with empathy and without empathy. But in general, the fact that you don't show emotion doesn't mean you don't have emotion. And a lot are seen with hyper-empathy. And you can imagine if you have hyper-empathy and you cannot communicate and you're sensitive to what's happening and people come and take you, again, or what you know, you may have big crises and be violent because of the desperation, not because you don't feel anything. So that's very important. And the same way, there's a way to imagine what's happening in the head of the other, theory of mind, right? But it's a different way to understand the other. So you're familiar with all that, yes? So very important, and for adult psychiatrists who don't think you can be autistic and have a job, you cannot be autistic and be a woman, right? So it's both sex. I work a lot in non-profit with very poor population, with immigrants, a lot from Central and South America, with autistic children who are diagnosed in the system in Los Angeles, and then we realize mom or dad, they also needed some help. And I think we need to revise the intellectual disability. For a long time, autism was always associated with severe intellectual disability. And now the way it's diagnosed, again, that's probably not a lot of the children you see, the way we look at it is different. So a study in England looked at children in hospital who were diagnosed autistic, and only 10% had intellectual disability. So no intellectual disability doesn't mean the person is not autistic. Yes? So my definition is the one you see here. And in 2017, in Australia, they create a word for autism, takiwatanga, and I really love that. It's insuproprio, tempio, and spasm. And I've been giving a lot of talk, and one mother called me a few months ago. She's a dentist, and she said her son didn't talk. ABA didn't work very much. She took a lot of care of him. And suddenly, at 14, he started talking. At 14 and a half, start being aware of his body. So there are a lot of things that I really think it's important to remember that. Again, you probably, I'm curious to hear your experience working with teenagers and children. Next. And yeah, all of it. So this is a little bit of the history. I just want to say a few things. You know, Bloller gives the name for autism, right? More with schizophrenia, the symptom of schizophrenia, like catatonia. And in general, we know Kanner and we know Asperger, right? Have you heard of Frankel and Weiss? So what happened is in the 30s, and first, Sukareva, she was a Russian Jewish psychiatrist. And she's the first who wrote description of girls, autistic girls. She was a child psychiatrist in the 30s. You can see the translation in English, her article I translated. She has very interesting description of girls. But she was a woman, she was Jewish, she was in a communist country. So I'm sure Kanner and Asperger read her, but they didn't cite her at the first work. Frankel and Weiss was a psychologist, Frankel was a psychiatrist, worked in the 30s in Vienna hospital. It was the biggest, the most important child psychiatry hospital in the world at the time. And he started observing autistic children and wrote a paper about the lack of affect and communication with emotions. Now, he was Jewish. So Asperger was his resident. They put the resident as the head of the service, and Frankel moved to the United States in 1936. So Asperger got all the work, and the psychologists designed a lot of tests that we're still doing today. And Frankel came in the US and he worked for Kanner. And he observed the children with Kanner. And then Kanner wrote the papers. Frankel was writing mostly in German, and we see what happened. I wanted just to see that it's not just a coincidence that we discover autism, that academic, historic politics is often, mixed. And then a few more things. Better language was very important in Belgium for psychoanalysis and all that, and you had this theory about the autism created by refrigerator mother. Betterling was not a psychoanalyst, he lied on his credential, and he was not a psychologist. But he did a lot, it has a lot of influence in Europe, in France and Belgium, I don't know, in Argentina, and it was really destructive for generations and generations of parents and kids because it was the mom's responsibility. Now, of us, this is quite ABA, but also thinking these kids have no feelings. We need to normalize them. We discover Asperger, discover that girls can be autistic. Temple Grandin was the first autistic person saying in a meeting of parents, I'm autistic. I said, oh, you can talk and you have to work, right? But as I said earlier, when she was 3, she couldn't talk. The doctor said she was brain damaged and the parents should send her away and never think about her. If they had done that, we would not know about her. Singers coined neurodiversity in 88. This is important for the US, but everywhere. That's when we say children need to receive education. They have the right to education, even if they have intellectual disability. So that's probably since then that we see more autistic kids who had education and now are adults. It's a long history. Neurodivergence, have you heard of Damian Milton? Double empathy problem? So that's quite important. He's autistic, his son is autistic with high needs, researchers, and said it's not that autistic people people have no empathy. The empathy, the way they understand the world is different, so they will understand one another better. But when they're an autistic person and a non-autistic person communicating, it's a problem. But the problem is on both sides. Okay. So, as you can go, so you've heard that, I don't know how you say in Spanish, bajo functionality, bajo. So bajo is a problem sometimes because we don't hope for the child that he can develop. For granted, if we didn't think she can do better, maybe we would never give access to support. And sometimes they have strength. This is no professor at Cambridge. He didn't speak and didn't write until 14 years old. Right? So the other problem is when you say high functioning, it's like if they have no problems. As I said in the introduction, if they mask enough, we think they're normal. But the price to pay emotionally is enormous, and that's why you can have a lot of burnout, a lot of depression, and someone who is a friend, a colleague, seems normal, and suddenly has meltdown. What do you say meltdown in Spanish? Crisis in our
regulación.
What's happening? Right? So they try not to say in English with low needs or high needs. And that's probably not the best course. Okay? So the problem with the DSM was that everything is in terms of deficits, not just for autism, but in particular for autism. So if you tell a parent your child is autistic and they go read the DSM, it's only bad things. And it's hard to build when you have only deficit and emptiness. So there is a problem, and that's the autistic community going to say it's not only a disease, can be a difference, can be a lot of problems and difficulties, but they are more than deficit and emptiness. And they may change the thing. The same way when we speak about restrictive behaviors, right? The need for sameness can be a big problem. Can be also how we have big researchers. This is Immanuel Kant, the philosopher. You know, Kant was doing the walk. It was so punctual that the neighbors were checking their clock on his walk. It was one of the great philosophers, Marie Curie. You need, if you have intense interest, you work without stopping, and it can also have advantages. And I think it's important. Yes. And what's important in the DSM-5 is they speak about the symptoms when it is a problem, disease, illness. Depends on the environment, of course. And what's important is they added the sensoriality to the diagnosis, because we're sick. This is one difference that stays for your entire life, and that's important. And we don't ask enough in adult psychiatry, you know, if people have problems or difficulty, hyperacusia, or things like that. So that was good in that case. So some of the characteristics that you see more when they develop in adults, and everyone can have problems, right? Greta, she just went in jail not long ago, right? Because she's defiant, she's persistent, but she can also be in trouble. I saw that you probably know this young man in Argentina. So there is, and again, not everybody, you have psychopathic autistic too, but you have a sense sometimes for justice, attention to detail, ability to hyper-focus, but you can hyper-focus so much that you don't go to the bathroom, you don't eat, you don't drink, and then you fall apart, right? So everything can be a positive or negative, but it's important to show that it can also be a positive experience. Yeah, it's very important. That's why we have so many researchers on Asperger, but we don't use the word, right, because of Nazi affiliation. But it was more clear for men, it was easier, specialists here were identified as Asperger, but women were kind of ignored. Do I go too fast?
No, it's okay.
Okay. All right. Pero, not as all rosy, right? It's a big problem. This is incredible. That's for autistic without intellectual disability. the life expectation is 20 years shorter. Cardiovascular disease, like the general population, also but early. Also because it's very hard to go to the doctor, we'll see that later. It's hard to trust, it's a difficulty to perceive the problems. But also suicide is the second cause of death.
In all ages?
In all ages, for adult autism without intellectual disability. So in the United States, suicide is the 11th cause of death. Right? So there are clearly big problems in that population. There are a lot of studies in England and Sweden. Is they die too early from physical problems, but also the suicide level is very, very...
This statistic is for all the spectrum, all the autistic.
Yeah. So
the more...
No, the one with intellectual disability, I think it's 35 years earlier. It's even earlier. But suicide is less. So...
not all the spectrum.
No.
Pardon.
Adults.
No. I don't say the...
Without intellectual disability.
No, I say todo el espectro.
No, cuando sí.
Pero no digo de edad, digo si desde el más leve, eso es desde el más leve hasta el más grave.
Sí, absolutely. But I think it's probably more for the persons who are camouflaging. Women are much higher. They see that women go into emergency room, autistic women are in general at a mortality much higher than autistic men or than non-autistic men and women because they come late, they don't express themselves well, they are not taken seriously because they may say I'm in pain, I think, and smile. And so the statistic, I can send it to you, are really bad and they don't look autistic, right? If you look really that you're different, then the doctor thinks, oh, right? That's why I give these talks. Because they don't look as autistic, they don't look as disabled, they have a job, but still they have this difficulty perceiving how they feel, and this difficulty communicating, difficulty staying in the waiting room, in the ER, because the light, because the sound, so they go back home. So there are a lot of things that are typical, but not as much in sound that you see. So this is very important. This is one of the reasons I give these talks. So there are also problems that you can find, the crisi nerviosa, the mutism, catatonia, that's why it's a lot of fraud diagnosed with schizophrenia, the self-harm, very, very frequent, that's why so many were sent to me as borderline, with borderline personality disorder. The interaction and sensibility are unusual, and it's very difficult to ask for help too. So, I think you all know how to identify autism. Maybe you do for adults, it's less, you see in a more subtle way that you will see in children, but I think for me, more than the DSM, that's where I looked at all these different aspects, perception, motricity, cognition, language interaction, and dysregulation of emotion. So I go a little quickly, but this explains, if we start at the roots, we start what's happening inside, explain a lot of the behavior. If you receive more, more impression sensorials than another person, you have more to treat. It takes more time, and it can be more overwhelming. And so, as you know, that's being described for autism, including the adults on the spectrum that don't seem as autistic. And what's very important is you have más altos de capacidad perceptiva, the experience are different, the reduced habituation is very important. And that stays also with time, so someone with 40. So if you have a noise, I'm sure you work with children, they don't get used to it. It makes them more and more upset. You have the same thing with adults. And that's very useful in the diagnosis with adults, because you can ask them, because they may have learned to make eye contact, learn to talk, learn to do things like you teach in India. But that doesn't change. So these are very important. It's also explained that in some therapy, cognitive therapy, and cognitive therapy for trauma, when you do exposure and exposure, it doesn't work. It hurts the person. They don't get used to it because the physiology is different. Any question? So we'll go quickly, and you see that there's more sensitivity to vision. The eye contact, I think, is very interesting because it was so important in ABA to make the child look normal, right, by making eye contact. When they do neuroimaging in autistic children and adults, they see that when you force the eye contact, the amygdala, the emotional brain, the center where you have fear, just light up very much. So it's a different physiology once again, and it's important. So a lot of my patients, when they come, they're adults, they see the psychiatrist, I see they look at me, look at my nose, and I say, you don't have to look at me. Psychoanalysis was great for that, right? You don't have to look. And for many persons, when they're forced, if they look at you, they cannot process what you say. So and I explain that, and I say, I much prefer you look wherever you want, and sometimes you look at me. So it's important to know that the person is not doing it because they don't want to work with me, but because it's a difference. So you're familiar with the difference in audition and the brutal noise and all that. So I think we can. Is it okay? Perception. Everybody's familiar with it, right? Although it's very important in eating disorders. We know that a lot of people with eating disorder are autistic, right? If you smell that are so great perfume maker, right? So that's important. The touch also, we see how some type of touch may be looked for, the heavy blanket, right? But sometimes a very light touch, maybe like a person has been hitting you. And there, I don't have it in this talk, they look at the different type of tactile receptors, the one we have for feel, and one connect with the emotional brain. And they are different in autistic people than in the one who are non-autistic. You can see that in one of the other talks I did. I didn't have the time to do. Big problem with pain. Because, again, one of the, Lovas was saying, you can hit these children, they don't feel anything. Right? That was UCLA 2 years ago, unfortunately. The way they respond to the pain, the perception of pain can be different. So some we see, again, sometimes with the neuroimaging, which, people believe more than what the person is saying, show that can be an excruciating pain. The pain can be enormous. On the other aspect is alexithymia. Are you familiar with alexithymia?
Yes.
So it's very important. It's not being able to feel or to evaluate. I think that's why so many adults who don't look autistic go to the ER and die early or have more problems. Is because they cannot really, they're not sure. They're uncomfortable, they don't like to be examined. And I think maybe if the doctor says it's not a problem, maybe I go home. And they die from a peritonitis at home. So it's very important for me when I discuss that with doctors, not psychiatrists, but primary care doctors. And also to say, so you have to ask the question differently, and you have to help the patient to find the word, you have to examine, explain what you do. But so that dollar different has a lot of consequences. So when you have too much of this, and again, even more when you don't, nobody thinks you're autistic, right? You're just a worker, you're a hard worker, you're a little weird, you're a little different, you eat always the same thing, wear always the same clothes, right? But all is good, and then suddenly, maybe you're burnout at work, something's happening, and you lose it, as we say in English, right? So you have already example of that you're familiar with stimming and all that. So that will create symptoms that will be identified as psychiatric disorder. I think you're all familiar with stimming, so we can increase of stimming. But think of, it's a story of this young African-American man who was going to the store, you know, in the US, and was like that, and didn't talk very much, and go back in the street, and someone called the police because he looks suspicious, right? It's a young autistic kid, been formally diagnosed, playing violin for the cat. And the police come and speak to him, and he said, you know, I'm different, but I'm okay, I'm going home. He just went to buy something. It's the US too, but so the police came to him and touched him. And he started freaking out. He had a meltdown. When you have a meltdown and you're a young black man in America or elsewhere, right? And so the police put in, and we have the recording, it's heartbreaking. You hear the recording, and you hear Elijah McLean is his name. It brings tears to my eyes. And Elijah says, I'm different, I'm not bad, I was just shopping, I'm a different person, please don't hurt me. And the police put him there, and the paramedic came and gave him a high dose of ketamine. Very high dose of ketamine, and he died. He was brain dead, he was 16 years old. The paramedic just received some jail time, actually. But you can imagine that's why it's so important in minorities and everybody. But it can be interpreted, and we want to also train the police. The police doesn't know, right? And in the video audio you hear, the police say, he has an incredible strength. And I remember the training, you know, catatonia, excited catatonia, when I was in training, people who suddenly have an incredible strength. And I suppose that may have happened. So this difference can really be source of trouble. Difference in, you're familiar, in motricity. Some sports are better than others, but of course that can be source of bullying, because a lot of adult autistic have a lot of traumatic history, including the bullying. If you cannot play soccer, right, in Belgium or here, you are a little more on the side, right? So this is important, and it's important when we do the history, when we speak with the adult, when you play sport when you were young. I was a swimming champion, but I couldn't touch a ball. All these things are important. So this is one, you know, we were discussing, is everybody autistic? How do we make a difference? How can I say this person is a doctor, is an actor? How can they be autistic? It's so different from what you see in children. And I think a very good way, because you cannot really cheat, is the neurocognitive testing. And so we speak about the spectrum, but spectrum is not the good word. Because spectrum calls show that it's like a continuity, right? A little bit autistic, a lot autistic. And it's not that, because of the cognition. So what we say, we look at more, you know, this able to make sounds, right? And so some will have a fabulous semantic memory, and executive memory in general is bad, right? Some will be able to calculate very quickly, and then, so for some tests, when you're familiar with psychological testing, with some tests, the person going to be on the 99th percentile. And then the other thing will be on the 23rd percentile. And then you can go to the next slide. And then the third one will be 40th percentile. And then the 5th percentile, because it's so slow, right? So an autistic person who is called spiky, I don't know if it's already in Spanish, but this is the profile, right? This is the result of the test. And the person is brilliant at a certain level, and then not good at others. A non-autistic person is like more, right? More or less like. That's very important again, because you will see, I see like 40-year-old women, and they were brilliant, everybody, but they were so smart. And they were so smart, and it was all these expectations. And then they couldn't work. Or they fall apart in college when the routine was not there. Or when college was great, they did this brilliant PhD, very detailed, and then they have to work. And then there are some basic contact or basic tasks they have to do, and they fall apart. Interacting at the coffee machine, I'm sure you do that, or the latte machine. And so So for this woman, when I speak with them, and some had testing, and the family say, well, she's not autistic, and they hide from, I have a few patients, a parent got official diagnosis and say, we're just going to do like, because sometimes they're right, we don't want her to go to special education, we want to continue. But so the patient, when you're brilliant and everybody thinks you should be here all the time, and you fail stupid tasks, you feel terrible about yourself. People say you're lazy. They say you don't make enough an effort, right? It's like you should forget that noise. Just forget, get used to it. There are things they cannot do. And so because they cannot do these things, the environment can say you're bad. And they can lose self-confidence and become depressed. So this is important. If it was not that expensive in the US, this is $6,000 to $7,000 American dollars to do the test, right? It's very expensive. Few insurance pay for it. So,
Vamos todos.
and you know, it takes a long time. I mean, the psychologist do it's 2 days and then it's reading the test. You pay for the hour, but it is a lot. But when you can do it, it's important. It's important for the person because they get to know themselves better. And they say, oh, I'm terrible at math. I'm on percentile 10. That's fine, I'm not lazy. It's just different. Right? So the concept, so that is very important. I think when you see, so if someone, say they're autistic or not, I think that is a good way to see it. Even if they seem that they fit, they have some great difficulty in something because that will not change with time. Right? Okay. If you have some questions or but so there's I had a picture here with Apple and Mac, Windows, so some autistic people say we have a different operating system, right? So Apple computers speak better with Apple computer and Windows, so I have differences. So you can have great capacity to focus, but you have also enormous difficulty to change attention, right? So you're gonna work and work and work, and then someone say, come to the meeting. And then you go back to work after the meeting and you cannot do anything else. It's very important when you work with people who are working to try to find accommodation for them. Perfectionist, but you may also never finish the thesis that you've been starting, right? Great way to recognize patterns. That's why we have a lot of discover and research and people who discover that, so that it's different. The way to learn is different. That can also, and you may see that in school, so in high school, elementary school, the child will learn something, but not the way the teacher teaches it. And you bring it back, and the teacher wants him to say the same ways. And so, again, the child pretend you cheated. He didn't. The brain is different. So it's like for educators, it's not important to know. I mean, some kids may cheat, but some kids have just come to the same conclusion in a different way. That's why a lot don't like regular educations. A lot of students and bright students, they don't want to go to school. They're bullied, they're bored, they're not interested, so it's complicated. And yes, go back. I think it's so that's important. You've heard that often autistic people see the trees before the forest. And again, you say, is that a bad thing? It's a different thing, right? You need people who see the tree first, and you see people who see the forest first. But because they look at the details first, often they're less influenced by the big pictures. And so Tamara Brandon said, we have a good, forgive my English, bullshit detector. Because she said, we are looking, so we're not so impressed by the forest, because we say, well, there are a few sick trees there, and there are wolves behind a tree there, right? So, but of course that makes autistic people often whistleblowers, because they speak without filter sometimes. They tell their boss, oh, you did a boring lecture today. What happened, right? And you can have a lot of social problems. Okay? It's like so again, speaking about these adults, it's a different way of communicating. You recognize Beckett, Virginia Woolf, James Joyce. Read James Joyce.
Yes.
They are so very unusual, a lot different logic. You don't see a lot of emotions in Beckett and James Joyce, right? There's a Fitzgerald, who's doing a lot of autistic Asperger in England, and Professor Fitzgerald thinks that they're all autistic. I tend to believe that, right? And interaction socials are different. She's a comic from Australia. She's hilarious. She was diagnosed autistic a few years ago, and she explained where the teacher asks some exercise, and she takes it very concrete way and makes the teacher really upset. So people are different. I see I'm taking a lot of time. And the empathy, so, you know, AI that everybody want to trust. Well, when you ask AI 3 months ago, representing an autistic person, that's what you had. Out of 170 pictures, it was 2 women, 3 people older, and none of them was smiling. So we're not replaced by AI yet, right? But it's very important in empathy, familiar with the difference between cognitive empathy and emotional empathy. The cognitive empathy is kind of what you learn is, oh, someone is sad. Someone tell me they lost their dog or their parents and they're sad, so I should say this thing or I should be this way. Psychopaths who have no empathy, no emotional empathy, are very good at that. They're very good at recognizing that and manipulating people. Autistic people are bad at cognitive empathy. They will learn it with time, but they don't see why. I remember the patient said, my mother lost her brother. The patient was 40, but I didn't cry. I told my mom, you never liked your brother. He was always mean to me. I see him 3 times in my life. Why would I be sad? It was very logical, but it didn't go well in the family reunion, right? But on the emotional empathy, clearly for a lot of autistic people, they have so much empathy, sometimes they have empathy for a stone. For animals, it's well known, right? But they have, and they're overwhelmed. They cannot watch violent movies. There are a lot of things they cannot watch because it's so overwhelming. So it's a big difference between empathy, cognitive, and emotional. And so what I mentioned earlier, so here you say you have a person who is autistic and a non-autistic. So they have difficulties communicate. Like when my patient tells our cousin, well, I'm not sad, I didn't like that uncle during the funerals. People say, well, she's so rude, she has no feelings, right? But that patient will be feeling terrible for a fly who's dying on the table, right? So what he discovered is that when you put 2 autistic people together, of course with similar cultures, similar level of intelligence and all that, right? Then they understand one another better. And they've done tons of studies. If you Google double empathy, they've done a lot of studies to show that actually the problem is in both directions. So if you ask an autistic person to guess what a non-autistic person, when another autistic person is feeling, they will be better at doing it than a non-autistic doctor identifying. So that's why I speak about double empathy. It's been 15 years now, and it's really to prove that being right. I think it was very important in humanizing autistic people. It's different, but there is something there. They're not empty. So I think we know the dysregulation of emotion, meltdown, we spoke about it. I like this idea, GPS. Have you heard that for the meltdown, right? You stay calm, you keep going into the direction, you avoid visual, now we know why, and I think you're all familiar with that. So, the self-harm is a very big problem, and that's one of the big reasons why women are misdiagnosed with borderline personality disorder. And it really regulates emotion in both, right? So it is a way to regulate emotion. With the probably there's a lot of research. We're not sure yet. Does it bring more endorphin? You know, does the pain make them feel more present? We're not sure yet. Could be an entire talk just on that. So that's good. And la catatonia, very important in the wrong diagnosis of schizophrenia, right? And of course, if you give Haldol to someone who is non-psychotic and catatonic, it is just going to make things worse, right? They're going to look schizophrenic. When we think of institutionalized people, and women in particular, that's really a big issue. So treatment benzo, of course. And sometimes, by the way, shutdown or catatonia is a way to avoid the meltdown. So people are protecting themselves, and it's very important to leave them alone. So you're all psychiatrists, psychologists, you know what to do, but I think when you ask a question about the family history, about the personal history, think of some of the things I was saying today. In terms of cognition, are you very good there, not so good here? Perception, all that is very important. When you do how do you tolerate change? Ask about special interest, very important. Very important, medical co-occurrence, comorbidity. We realize that they're much more frequent. So if you have someone with LR-Downers, particularly women, think of autism. It's very frequent. A lot of GI problems. Of course, epilepsy, that's the one we knew. A lot of autoimmune. There are papers coming out about long COVID. A lot of autistic people, women with LR-Downers and long COVID. There's something about the immune system that's different. So that's also important to think of that. And all these are problems that often the doctors say it's in your head, it doesn't exist. And it exists and people can die. So that's dysautonomia, hot, right? Very important. We know that's a difference in the melatonin secretion, a lot of sleep problem. Melatonin is a hormone, so these are basic treatment. We do what we're doing already with children. We give the melatonin, low magnesium. Magnesium is important for sleep, but also for the management of stress. There's some specific deficit in B12, but remember, also different way to eat. A lot of eating disorder, so you can have vitamin D. I have a patient who was paranoid and autistic. They removed part of his stomach, and his family called me, and he was in his 50s. He had a severely autistic son, but the father was never diagnosed. And then the father is 50, and he become more and more paranoid, more and more psychotic. And then he thinks people are after them, and then he want to buy a gun. We're in America, and then he thinks his wife is cheating on him. So you really see the dangerous evolution. And they were ready to send him in the ER, and schizophrenia, late schizophrenia, right? And we did the B12 level, and the B12 was very, very low. And the symptoms of B12 deficit looks like a paranoid psychosis. So it's why it's so important to see the entire body, of course. So here, so comorbidity, of course you have everything you have in psychiatry, right? And human too. So, and here you have some prevalence, so you can look at it. ADHD, and it's very complicated because autistic and ADHD pull in one direction, and the autism pull in the other direction. Very difficult for patients, but a very, very high co-occurrence. So the sleep is what I said, you have no way to measure sleep and see the percent of deep sleep, the percent of REM sleep. Again, sometimes you have difference there. Anxiety, some people would say, well, that's just like 85% and a lot of anxiety. Probably why a lot of people may drink alcohol to socially function in certain ways. So the anxiety is very important, and that's good to see the pattern. Is it because we don't like a change in habits, right? We were working in one unit, everything was great. If this person is a great worker, for 20 years did the same task, get a promotion, and fall apart. Because there's a new environment, new people, and didn't have time to transition and couldn't take it. So, the mood troubles, right? So, again, you have the family is trying being a good clinician. That's why we need time, right? And I heard here it's like in the United States, they give us less and less time to see a patient for the first time, and we need the time to ask all these questions. But I have a lot of patients as a PPD or autistic who were diagnosed with bipolar 1 because the doctor saw them for 15 minutes. They had crisis. They were not sleeping for a few days because they were working their thesis, they were falling apart, they were suicidal, and we give Depakote, right? Because that's how medicine is a lot in the US. So, and they come back, they're young women, they want kids, and we look at the history, no family history of bipolar 1. You know, a big issue in California is marijuana. Marijuana has been legalized for years, and they make it stronger and stronger and stronger, right? So the marijuana 10, 20 years ago was like we drink a light beer. And marijuana now has been so powerful, it's like you drink the alcohol you put in your car or something. I mean, it's crazy. So I've seen a lot of young people with psychotic episodes, and so that can be a big issue. And like starting schizophrenia, more young men, more schizophrenia, that's my personal experience. Young women more like bipolar. But so, and some doctors.
Acá anterior, perdón.
Okay.
I'm sorry.
Some doctors who use marijuana recreatively, it's like in the past doctors were drinking wine, they didn't think wine was a problem, right? Some young doctor I know use marijuana, and it's very difficult for them to recognize that for maybe 10%, 15% patient. It can really start a psychotic episode. But if you don't think of the marijuana, you say you're bipolar, right? And you treat it differently, the future is different. So I always try to see, let's stop the toxic, let's see what happened. I give medication, but I want to give them when I think it's really necessary. So the risk of suicide, right, is very important. The camouflage. So the better the autistic person has been to hide it, to look normal, it takes a lot of energy. And they can have burnout. This is very frequent. And when you have these people who nobody expects them, I think so, in the US, 2 doctors kill themselves every day. I was on the helpline during COVID, to a very high rate, and women. Okay, I don't say they are autistic, but I'm just saying that people who are high functioning, doing a lot of things, have a lot of expectation, they fall apart. And in the US, if you're a doctor, they're scared to see a psychiatrist. Because when you see a psychiatrist as a doctor, you have to report it to the board. And every 2 years, we have to apply for a renewal of our license. So doctors self-treat, they don't come to psychiatrists. And during COVID, colleagues of mine did a helpline for doctors, and it was anonymous. And we were psychiatrists from all over the country, helping doctors from all over the country. We still are on. The horror, the depression, the trauma of doctors, and they're terrified of asking for help. So we want to try to change the law. But so you can imagine if you fall apart, you don't know where to have help. That's what when someone says you're autistic. It's a very high danger of suicide. So that's again explain what we said. You can have access to the slides, right? So, but it's important in the burnout, in the autistic burnout. You have just one thing before. You have a loss of abilities. So people who could do the job suddenly, there's not a state they're depressed and sad, is that they cannot function. That loss of ability of something that was done easily before is an important sign in the regression. So of course you recognize right here, right? It's a
Elon Musk.
This is very concrete, right? He wrote the thing anyway. So you have, of course, narcissists. You have, of course, psychopathic, autistic. Absolutely, autistic people without empathy. It's it's like all the humans. So OCD, very frequent. I'm sure you see that a lot with children, I imagine. And it's very important in adult and a lot of trouble. So before that, because I remember in my class you say a lot of borderline. And I think, so what type of problem is it? Depends on Anthony Hopkins has been diagnosed in his 60s, as you just say, and he's been sober for 50 years. And I suspect James Joyce, of course, could write on that. There was a severe alcoholic, killed him at 50 years old. And schizophrenia, I spoke about that a lot before, and a very bad reaction to antipsychotic. Make sure that's the difference between a delusion or an obsession, because it's your interest, it's your special interest. So you want, and catatonia, again, think of it, catatonia doesn't mean necessarily bipolar or schizophrenia. Okay? Oh, do you know who was this before? Sorry. This is Einstein's son. And Einstein's son was a brilliant young man, studied to be a psychiatrist too. And you know, Einstein, the mother contribute a lot in the theory of Einstein. He gave her the money of the Nobel Prize. So you can imagine that the son of these two little bright minds may have been autistic, I don't know, but they say he was schizophrenic, and he was institutionalized at 29 or 30 years old, and was institutionalized for almost 30 years. So, I think any good doctor and psychologist anymore would do that. But I have some time to remind my colleagues and doctors they're important to listen, to believe what the patient is saying. I don't know here, but in the United States, where everything goes fast, and doctors are trained some ways, and they don't know what they don't know, they don't believe the patients. Patients say they have side effects, they don't believe it. They give more medication, right? So give time, we see the processing is different. And again, the person may look normal and smart. They may have enormous difficulties in expressing some things, the alexithymia, the problems, emotion regulations, the shame among the difficulties. This is, so there's a group called Autistic Doctors International, because you have autistic doctors. Mary Doherty is an Irish anesthetist. Both children are autistic, and then while her kids were diagnosed, she realized that she had a lot of the same difficulties. And she created that group, you have the link to that, and the group created a paper not long ago to adapt the environment, again it's for adults more, but to respect, the physical space, make sure it's predictable, pay attention to sensory, again, all things you're very aware of. It's a free article, so I'm trying to change the mind of, again, not just psychiatrists and psychologists, but everybody, the nurse, the primary care doctor. I don't know your experience with kids, but with adults, they have a very different response to medications. Sometimes I give a fifth of the dosage, a tenth of the dosage, and again, you say, well, it shouldn't work. I believe the patient, the pharmaceutical company. So, rare times you need a higher dose, but very often you need very low dose. And if you start too high, then the patient may never want to try it again. Because that's so, I use a lot of bupropion, Wellbutrin for instance, because a lot of ADHD, autism, you have bupropion?
Yes.
Which I kind of like, it helps the D2, but I have patients at 37.5 milligram, adults, 45-year-old women, we start 75, and she was too anxious, and she's taking 37.5. So you really have to be flexible with that. I put the sport car and tell patients that you're like a sports car. So if you touch a little bit too quickly, you have to be careful. So my conclusion, I'm sorry, I'm going to try my Spanish again. And I don't have my glasses, so. Conclusion. Demasiadas personas autistas mueren demasiado pronto, sufren demasiadas dolencias psiquiátricas y médicas, sin que necesariamente puedan recibir el apoyo adecuado. Identificar el autismo supone un alivio para todos, porque aporta un nuevo cuadro para comprender mejor las dificultades dificultades interpersonales, sociales, físicas y sensoriperceptivas. Recuerda el problema de doble empatía. Conocerse mutuamente es un camino de doble sentido, pero no una tarea imposible. Las personas autistas y no autistas son diferentes, sí, pero también tienen mucho en común. Cuando nos comunicamos de forma más clara, respetuosa, cuando por ambas partes intentamos asimilar las perspectivas del otro, todos nos beneficiamos de ellos. Tener en cuenta el autismo cuando se trabaja con un paciente puede suponer una gran diferencia a la hora de facilitar el trabajo conjunto y disminuir el riesgo de una muerte prematura. Espero sinceramente que esta conferencia contribuya a ayudarles a marcar esa diferencia. Muchas gracias.